resources or interventions that Black families can utilize to for prevention?
Well, there are a couple of things. First and foremost, I think one of the gentlemen before talked a lot about nutrition. It's very important to look at what you're eating. A lot of the things that we're eating now predispose to a lot of the medical conditions that we're seeing, like diabetes and hypertension. I mean, my great-grandmother and grandmother, we ate from the land, fresh, healthy food. A lot of our foods are filled with sugar and preservatives, which preclude to a lot of the things we are seeing, diabetes and hypertension. So that's the first thing. The second thing is that I think that our community is not aware of is vitamin D. Vitamin D is a vitamin that is made in the skin in conjunction with sunlight. Black people lack the ability to convert adequate vitamin D production in the body, and as such, all of us are deficient. Vitamin D is important in dentation, bone development, cardiovascular health, prevention of preterm labor, and in the time of COVID, it is really important because it is an immunologic booster. If you look at the research that has come out, a lot of people that died from COVID were people that looked like us and people who had deficient vitamin D levels. Vitamin D is not expensive. You can get it over the counter. I think it's important that everybody, but particularly pregnant women, get their vitamin D levels checked. That's the second thing. The third thing is, if a woman is thinking of getting pregnant and she has underlying medical conditions like diabetes or hypertension, get that in order before you even get pregnant, because those things not only can be detrimental to you, but detrimental to the development of your baby. That's the third thing. The fourth thing is, I think it's important to have discussions with those that are in leadership to expand Medicaid, particularly in the fourth trimester, because that's when we see a lot of the morbidity and mortality in our community. So if I want to talk about those are the four top things.
Thank you very much. Next, Dr. Matt. Obesity is highly prevalent and it's on the rise in our community. According to the Center for Disease Control and the National Institute of Health, 1 in 5 children ages 2 to 19 years of age are obese. An additional 14% are overweight. African Americans and Latinx children are more overweight statistically than white children, and approximately 35% of African American children 2 to 19 years of age are overweight or obese. So Dr. Matt, how serious of an issue is childhood obesity and what are the dangers?
Yes, thank you for asking that. I think you talked about how prevalent it is, and we see a lot of obesity in our children, and those numbers are staggering. This has been a problem that we've been aware of at least for the past 20 years, that every year just the number of our children who are obese and obese at an earlier age is on the rise. And then COVID happened and the pandemic and quarantine. And so those problems were even further exacerbated as people stayed in the house, didn't get exercise, didn't have access. So that's the prevalence of the problem and why is it so serious? The obesity, particularly obesity at a young age, predisposes you to a lot of problems that come on later in life. A great example is diabetes. Type 2 diabetes, which as a pediatrician, when I was training, we didn't talk about type 2 diabetes. Type 2 diabetes was an adult disease. Adults get type 2 diabetes from a long life but since we have obesity so early, I'm starting to see type 2 diabetes in young children. And that's just a sort of a shocking development and a way of, and along with diabetes, we talk about high blood pressure, and then also problems with the stigma there's been links of obesity with depression and those types of problems. So all of this makes it a very serious problem and one that we need to address.
Thank you. And what are some preventive measures for patients?
So there are things that we can do, and they're not complicated. So there are a lot of complicated types of diets and a lot of complicated kinds of things that people are doing. But one is to consume less calories, and then to move, to exercise and burn off the calories that you consume. It is important, Dr. Gator mentioned about consuming calories from the land that are fresh, not pumped full of preservatives and salt and sugar. And so part of that means changing our diet habits. So that doesn't mean going on a diet that's gonna help you lose weight over the next 6 months, but to change your diet habits in the long term. For instance, you have to decondition yourself to only tasting salt and fat. Use your different spices and herbs to develop flavor in your foods so that you notice those types of taste rather than just what you get at the fast food restaurants, which is really salt with a sugar coating, right? The other things is to move and to work exercise into your day. One of the big things, and I thought about coming over here, is build walking into your day. And the cities are made for this kind of thing. This is why we have boulevards. We got 3 separate boulevards, and boulevards are made for walking. And so because they're wide streets, you can walk down. If there's a family, you can walk abreast of each other because we have wide boulevards to walk down. And it's a change in lifestyle, a change in thought. Whenever I walk more than 10 blocks in New York, I meet somebody that I haven't seen in 10 years, right? That's why you walk. You have to walk. You got to get out. You got to move. You got to build exercise into your life.
Thank you for those suggestions. And what resources are available to help parents?
So in terms of resources, there are a lot of things that you can do. The CDC at cdc.gov is a nice place to go on and for a lot of these types of diseases and look and see suggestions on things to do. We have access, which is not true in a lot of places, but in Harlem and in New York, we have access to fresh food and the fresh fruits and produce. So make sure to make use of your farmers markets when they come in. This is a way of supporting the food that's coming from the land. It's a way of developing your dietary habits, and a way of introducing this to your kids as a way of life.
Okay, thank you. Dr. McKnight, mental health is a serious and a broad health concern in our community. And according to the Health and Human Services Offices of Minority Health, it reveals that Black adults are more likely than white adults to report persistent symptoms of stress, and that Black adults living in poverty are more than twice as likely to report serious stress than those with more financial security. So, Dr. McKnight, can you elaborate on the mental health crisis and why you think it is more prevalent in the Black community?
Thank you so much for asking that question. I think that one of the rappers said, is it more money, more stress, more problems, or it's not enough money, more problems? Well, I suggest that when you mention financial problems, that not having enough money sometimes can be quite stressful. But to be quite honest with all of you, from the time our ancestors arrived on this soil, and we still today endure a tremendous amount of stress. Those who, in fact, wanted to be free were said to be mentally ill in 1980. In 1851, they coined the term dipetomania, mania for freedom. So I say that we all have dipetomania, mania for freedom. We all want to be free and continue to want to be free. They also coined the term for those who lost their motivation to work. How many of us would lose our motivation to work if we didn't get paid? All of us would lose our motivation to work. So we've always been under a tremendous amount of stress. And while some may argue that things have improved, I say maybe for a few, but as a group, we still have quite a ways to go and much improvement we need to do. And as people living in America, we endure a tremendous amount of stress daily, unrelenting stress as we constantly deal with and face what they call now microaggressions. Just those little things that keep nagging at you. And we all experience that, no matter what field you're in. But those things add up, and they can certainly cause you to be more at risk of developing depression, anxiety disorders such as panic disorder, substance abuse disorder. Some people just go home and say, well, let me just have a drink to kind of relieve some of that stress, and more severe illnesses, of course. So stress, constant stress, is not something that we all should live under, but we do find ourselves living under quite a bit of that. And as a result of that, it can put us at risk for a lot of mental illnesses.
Thank you very much. One study showed that 63% of Blacks believe mental health condition is a sign of weakness, and there are negative connotations associated with receiving therapy. So do you have suggestions or resources for those afraid to come forward and seek help?
Well, I think that a lot of it is misconceptions, believe it or not. I think that we've come a ways when it comes to mental health. But in working at various clinics around the city, prior to coming here, I worked at Atlanta, where I worked in a number of the clinics there, working with people of color mainly. We do come forward and we do seek treatment for our kids. I'm also a child psychiatrist also. So for our kids, for our mothers, our fathers, so we do come forward. So I think that we need to also push aside a lot of the misconceptions that people throw out on us, which we deal with constantly. But there are people who do have, who see mental illness as a weakness. And I say it's time for us to turn that around. In fact, those who don't seek help for mental illness, that's a weakness.
Okay, thank you, thank you. Okay, and this is for all speakers. What role does racism play in these illnesses?
Okay, let me just give a little blurb. Racism, as the doctor said, causes an increase in cortisol.
Yes.
Cortisol is the stress hormone. There's something called epigenetic factors. And epigenetic factors are external stimuli which can cause internal changes. Now, if we're talking about a pregnant woman, constant stress, constant cortisol causes changes. It increases your blood pressure. It decreases your immune function. It alters the manner in which you clot. So hemorrhage, preterm labor, which is a manifestation of infection, preeclampsia. So I could go on, but when you start talking about external factors, racism, bias, increasing your cortisol, this causes physiologic detrimental changes to your body. So that's one thing. The other thing that I wanted to mention that I forgot, when you asked me about what are some things that Black families can do to help to decrease the Black mortality that we're seeing. There are different healthcare providers that are helpful to Black women maneuvering their perinatal care. Doulas. Doulas are non-clinical providers that serve as patient advocates. To break it down, they watch your back while you're in labor. They watch your back during prenatal care. They make sure that what somebody is saying to you is cogent and not something crazy. They make sure that what's going on with that fetal heart strip looks right and that it's time for you to, go back for a C-section. So with that being said, I'll introduce one of my friends, Miss Denise Bowles, bolddoula.com. If mothers are interested in having somebody watch their back, helpful to have a doula, and your insurance company does pay for doula support. Midwives are also good for low risk patients. So when we talk about things that can help decrease maternal mortality, having a provider that your family uses, because word of mouth is the best word of mouth. It is helpful to also have a provider, I think, who looks like you, because we have the same experiences. We understand when you say something to us, we hear it and can act accordingly. The National Medical Association is an organization of Black physicians, of which we are proud members, that can help maneuver and guide you in choosing providers based on what your health issue is. Be it for pregnancy, be it for childcare, be it for your mental health. So those are all things that one can utilize to maneuver the health field and have some good outcomes.
Thank you very much. Okay. Anyone else on the panel want to?
Well, I was going to talk about racism as it affects obesity, and the cortisol and the stress lead to just directly and chemically lead to the storage of fat and adipose. And then there's also we've had the term for a while, food desert, where you live in a neighborhood, live in a community where you have to travel in order to get to a grocery store where you can buy a healthy food. And now we're talking about food swamps, where you live in a neighborhood where there's plenty of food around you. It's just that it's all calories, it's not nutrition. And that's one of the things, because when you go to the fast food, sometimes that is an inexpensive meal for some of these fast foods. You can get $1 burger. Calories are inexpensive. Nutrition is expensive. And so these are things that we deal with and that are built into the society, where the obesity can be linked directly to structural racism.
Okay, thank you. And Dr. McKnight?
Well, yeah, I touched upon racism in my talk, but I guess I would like to mention a bit about our youth, pretty much as a child and adolescent psychiatrist. And I think that we need to connect our mental health to all of our senses and realize, and I think we all know this basic stuff, but realize that what we see, what we hear, all of that affect our mental state. And so we find that a lot of our youth are sitting around and playing on the computer and all kinds of games constantly about shooting and killing and whatever, and that desensitizes them to this. And so that's why we've seen this increase in the shooting and these killings and what have you. And sometimes that's coming from a higher power, who knows? And a lot of that reflects back on ourselves and our community. We're killing each other and what have you. So we need to also work with our youth and just make them aware of societal racism and things like that. I'm fortunate to have a daughter who's a historian, and her main area of study is slavery. So she goes around the country to all these museums, making sure they tell the story correctly. Because if we're not there, they're going to tell it the way they want to tell it.
Thank you so much. So I would like to thank you for joining us today, and we hope you learned new information and some preventive resources. I want to give a special appreciation and shout out to the panel, Drs. Gaither, Dr. Mack, and Dr. McKnight. Thank you for your dedication addressing these and other disparities in our community. Thank you. Okay, yes, sir.
I have a question. How does racism affect black men in anger? And because the reason why I say that is because Jonathan Joyce is on our side of Trump, and you kept connecting to slavery, you kept connecting certain things. I said with Dr. Scott one time, yes.
Thank you. My question, so if no one heard, my question would be is how do racism affect black men's in anger? Because there's also a lack of fathers in the house.
Yes.
And I've been a godfather to several kids to keep them out of ACS. And I saw some techniques that I had to use. One of them was to communicate with the kids at home a lot and also be in the school. So my question would be is how does racism affect black men in anger?
Well, we certainly can think back and know that from the very time of slavery, they've always wanted to split out families and remove fathers from homes. This continued even with the welfare system. If you're on welfare, your father cannot live in the home. Can you imagine? So it splits the family. And of course, myself being an African American male, I would certainly be upset and angry if I'm not available for my family, or for my wife, or my daughter, or whatever. So I think as African American males, yes, there is an innocence of anger that we have to all work to harness and keep, and to hopefully use it in another direction where it's more positive. And you mentioned positive things, us mentoring others. We do need to do our mentoring programs are needed for our young black males, definitely.
Yes, thank you. My question is dealing with the increase of elders in our prison systems and elder abuse and medical neglect that goes on there. What can be done to deal with that? Particularly talking about racism, because we do make up the majority of our population, which is well over 2 million now.
So the question is about elder abuse and medical neglect. And I think, and Dr. Gator has touched on some of this, is that it is always important for our elderly to have an advocate. When you are interacting with the medical system, it's unfortunate, but it's true. You do better when you have somebody to advocate on your behalf. When you are sick, you can't always be your best advocate. And so having somebody to come with you to appointments, and to just to walk you through, just make sure that everything that was transmitted and got all of that done. As I think about my own parents, and it's a little bit ridiculous for us to assume that they should be able to negotiate all of this on their own. We need to step up, and as the younger generation, include that as part of our responsibility is to be their advocate when they have to interact with the medical system. You do much better when you have your advocate.
In the prison, although in the prison system, we can have restrictions and you can't really have advocacy. Like when COVID took place, a lot of information, doctors didn't go to the prison and all that. And a lot of us have family members who are in prison. And they know us. That whole dynamic, what can be done?
And so the prison system is a difficult situation, and I think I'm hearing you say that when we have our young men and our elderly men in the prison system, they need somebody also who can advocate for them. It's much harder to make those steps in order to get that done. What other types of things have been tried in terms of working with our prison system? And they have some, I know in a lot of our hospitals, we have prison doctors who go out and work with the prison, especially in the youth. I'm familiar with that a lot. We have youth doctors who go out and work with prisons. I think this is another situation where we have to access our institutions and our church institutions. So prison ministries are a big thing in our churches, and so this is a place where we have to, it's not something I'm an expert on, but that's where I would imagine our answers would come from. And also where I would imagine you would get a better answer from up here than if you talk to one of our prison ministries.
Just to piggyback off of what he said about the elder abuse, because I myself experienced that. My mom, a double amputee, had some health challenges with high blood pressure, being hospitalized. In turn, the social worker, the medical team has meetings without the family members. They counted up, calculated. I'm a veteran family, so my mom was a wife of a vet. And my dad transitioned. She had her Social Security and pension. So in order not to keep her at home so that the money can go to the rehab or retirement center, they threatened me with APS case. And I joined the Omnibus, am I saying it right? The Omnibus? I joined that team. And I fought for my mom. And I had a good long 7 years after that with her. I was the advocate, I was her power of attorney, and I was the beneficiary. And they knew if they could knock me out the picture, all the money would be funneled. And this is sad how they do our elders, but I experienced that. I just want to piggyback off of that. Thank you.
God bless.
I wanted to ask, I just wanted to ask the young lady here. When women are pregnant, how far along does it take? I saw something on TV that black women have more C-sections than white women. When you're in pregnancy, how long does it take the doctor to realize before you might need a cesarean? Is he monitoring you, watching you properly, ensure that he can deliver you, from the vaginal area?
It depends on what the clinical situation is. Black women do have more C-sections, but there are certain conditions that might preclude to it. Black women have higher incidences of high blood pressure, increased risk of preeclampsia. Preeclampsia, you need to be delivered. It might need to be an expeditious delivery by having a C-section. Black women have higher rates of having fibroids. Fibroids are benign tumors of the uterus. No one knows why. It could be genetic. But Black women have more fibroid tumors of their uterus, and therefore their labor might not progress normally, and they might need a C-section. Or the fibroid might be so large and obstructing that the baby can't come out vaginally, so you need a C-section. Black women have an increased risk of having morbid obesity. Fat on the outside, also fat on the inside, precluding normal vaginal delivery sometimes. So you can't just come out and say Black women have more C-sections without qualifying that with why. So obesity, fibroids. Huh?
So if that was the only thing you're saying, I was not discussing the program.
It never
It was not discussed.
It never is. So you have to qualify that with why.
Yeah, just this last question. No, but she,
Thank you.
yes, thank you.
I appreciate that. I just wanted to open up by saying I appreciate the breadth of the panel because it definitely intersects, right? So, Black women, Black female, Black people mortality in pregnancy, obesity, and mental health, right? One thing I do want to push back on a little bit was having someone look like me is not enough. It's just not. Because many of the hostilities that Black people face in the medical field are often from other Black professionals, right?
That's true.
So it's a matter of not just being Black or being brown. Where is the commitment on behalf of that medical practitioner to abandon that sort of colonial medicine that causes so much stress. Because in many of our environments, we're just interacting with a representative of colonialism. Since the brother brought up slavery and how it has contributed to what was the elder over here that talked about post-traumatic slave syndrome, right? So it doesn't matter if she's black. It doesn't matter because, to be honest with you, I've been treated the worst by black medical practitioners because they absorb all of the most disgusting stereotypes about my blackness.
Some. Not all, sister. Not all.
Don't disqualify my experience. I said to you, in my experience, I've been treated the worst by black medical practitioners. So I open that up to say that as we grow as professionals, I'm a professional too, I can tell you a kind, but we have to be very careful not to toe the colonial line, where it manifests in the way that we do our jobs, like in doula services, right? Because black women have higher mortality rates. We need black doulas. Really, all of those are social cues for now money, right? Because there will always doulas before the state decide to regulate it and start pulling money. These statistics get put out because now it starts the grants, it starts the funding, it starts the same colonial people that raise my cortisol and give me this belly, ways to get funding streams from the state and from other forms of nonprofits and governments, right? So that was the purpose of my comment, to make sure that the panelists understand that when you're up here and you're pushing the medical, the statistics, the people, the masses, we need to hear, how does it fit with your revolutionary politics? Because before the African American Day Parade, it was UNIA parade, right? Okay, so how does your profession, your medical profession, fit into your revolutionary politics? Are we doing this work to release ourselves from colonialism, right? Because we didn't die of COVID, we died of colonialism because it was those circumstances and those conditions for which you mentioned. Lack of housing, lack of medical care, lack of attention, everything that you guys very succinctly and eloquently mentioned contributed to COVID being a threat and a danger in our communities, right? And with respect to obesity, what did the former administration immediately do when it was time for lockdowns? They managed to find all of the black parks and cut the hoops out. Did the Blasio do that? He went to every black park and cut the hoops out. I don't recall any medical professionals speaking out against that. Right? It can't be left up to a few scrappy people in the street to jump out in the street and get our necks broke when we speak out. It has to also be professionals included. Meanwhile, everybody on Pier 35 was sunbathing with no mask, laying out right next to cops, but all of our playgrounds were locked down and shut out. But then you're gonna have learning loss, right? That's gonna be the next money maker. Learning loss, black mental health. You know how hard it is to get mental health access? You call up a number right now, they'll tell you the next appointment. When my primary care physician told me, well, Ms. Jones, maybe you should talk to a therapist. That was in June of 2020. You know when the appointment was? May of 2021. That is the next available appointment, 11 months later. I could keep all y'all like that, but I didn't. So I'm saying all of
God
that to
bless.
say, we don't need the stats, right? We don't need those medical explanations that get granular. We want to see the black power. Where is it? That's what we want to see, and how you fold that into the work that you do. Thank you, everyone.
Thank you.
I was born right across the street at a lot of the questions that were posed here, these professionals did go back to history. Black male anger, the black man who came off the slave ship did not go to the plantation. They went to breeding plantations.
That's right.
Breeding. Yes. And that really demoralized our black men and gave America a reason to stigmatize our black men to this day based on their sexuality. So what Chandra essentially needs to do is to retain someone like me who teaches about this right? But you need to know it in order to move forward with your politicians and with your healthcare professionals, because you only know the story that the victors want to tell.
Yes. Thank you.
Thank you.
Thanks, everybody.
Thanks so much.
I just want to thank everyone for coming. This concludes our Talking the Health Care discussion in our press conference. We will see you all September 18th. Next Sunday. See you September 18th. Thank you. Thank you, Dr. Matt.
She stopped taking my insurance, girl. And so I couldn't go back to her. And this last time, yeah.